We've got Amy with Bakhita Empowerment Initiative. Hey,
Hi,
there she is. How are you?
I'm doing okay. How are you?
Good. You look great.
I did it on purpose.
I,
Finally, a reason to get made up. No,
yeah.
ma'am.
I'm just using a filter because I just cannot be bothered to do makeup anymore. I quit at life.
Yeah, I've been doing that mostly, but today I was like, you know what? I'm gonna get dressed. I'm gonna wear makeup. It's gonna be great.
Yeah. Well, yeah, you look awesome. So thank
Thank
you
you.
for showing up and for like bringing it.
I will warn you that there will probably be children in the background because anytime there's a camera around, they are drawn to it, no matter what I tell them. Like I've told them to stay away, but we may see a face.
That's no worries at all. I mean, if they've got anything to add to this conversation, they are welcome.
I'm teaching them.
Okay, well, let's go ahead and get started. So can you introduce yourself and what do you do?
Sure. My name is Amy Nace-DeGonda, and I'm the Assistant Program Director at Bakhita Empowerment Initiative with Catholic Charities of Louisville.
Okay, and can you tell us a little bit about what Bakhita Empowerment Initiative does?
Sure. We're an anti-trafficking program that provides direct services to those that have been trafficked for sex or labor, male or female, foreign-born or domestic. We also provide prevention education groups, My Life, My Choice for adolescent females, and I Am Empowerment for adolescent males. And we do a lot of different trainings, outreach, and awareness.
That's awesome. And I'm familiar with a lot of work that you do because obviously we've been on a task force together in Nelson County for years now.
Yeah.
Yeah, exactly. And you're on the Stop Traffic Kentucky board as well.
Yes.
So you're super involved. And how long have you been doing this work?
So my position at Catholic Charities, I've been with Catholic Charities for a little over 6 years, but I've been in the anti-trafficking field in some way, shape, or form for over 10 because I was on the Louisville Metro task force in the very beginning and then was the co-chair for a while.
Oh, wow. Okay, I didn't know that. Cool. So, like I still feel like we still have to give a definition of human trafficking, even though like you and I kind of know it backwards and forwards at this point, but there's still a lot of people who don't know what trafficking is or think that they know what it is. So can you give us kind of a general idea of what trafficking is for both labor and sex trafficking?
Sure. So with sex trafficking, it's a person being compelled by another person or persons to perform some type of commercial sex act through either force, fraud, or coercion. And when I'm talking about commercial sex act, it has to have that exchange of some kind. And that does not necessarily mean it's monetary, even though I think a lot of people think it's just monetary, but it could be for, a place to stay, for a ride. It could be for something to eat. When we're talking about labor trafficking, we're, talking about somebody that is being compelled by a person or persons to perform some type of forced labor act. And you have to have those three elements of either force, fraud, or coercion. And I think that a lot of times when you're talking about trafficking, people understand the force part, whether that's, like physical, like harm or physical restraint, but have a harder time understanding about the fraud or coercion pieces.
Right. Okay. So you're obviously working from home. You mentioned your kids. So besides that, how else has this like quarantine, the coronavirus, COVID-19 affected your work?
So overall, we are all trying to work from home as much as possible. So that has, we've had to cancel trainings that we were doing, other awareness activities, with in regards to our prevention education groups. We're not able to go to the places anymore. And so actually our prevention education coordinator is finishing up two groups, one I Am Empowerment and another of My Life, My Choice through like the Zoom. So they're going to do it virtually. And then, our case managers, a lot of them have been doing things virtually. We've, seen it shift more away from actual case management to more emotional support, because what we are seeing is a lot of, our program participants are really just needing that emotional support, just like you and I, it's overwhelming for you and I, it's overwhelming for everybody. It's hard to understand. And that can exacerbate the trauma. So, we're trying to ensure that, we are meeting that need as much as we can. It's also, been difficult because people are needing more resources. And of course, those resources are maybe not as readily available because everybody has kind of had to scale things down, or, resources are just being, I'm trying to think of the word, there's such a need for it that it's really hard, even if it's available, to be able to get through.
Right. Well, I remember one of the things that you did when you were working as like a case manager was like you would like physically go and help, people get around, help them get their groceries. So how are those like sort of physical things that you used to do or like case managers do now? How have those been impacted? I mean, is that even possible to do anymore?
It's not, no, it's not possible because we're trying to follow, the orders from the governor as, strictly as we can. We did write policy in, about this, it's all new.
Sure.
And, I think we're kind of learning week to week as we go. But one of the things that we have, ensured is that, our program participants are getting access to TARP tickets if they need it. And what we've been doing in regards to like food, is we are purchasing a Kroger card and then bringing that to the person so that then they are able to get their groceries, whether they, do it delivery or whatever. But we, want to make sure that all our program participants are getting their needs met. And so that means being creative.
Sure. Can you disclose about how many program participants you all have right now?
I'm sure you're going to ask me like stats right now off the top of my
Sorry.
head.
Yeah.
I'm trying to think with the case managers. I would say we probably have around 20 to 25 at this current time. Okay. And some are more, some we're seeing more intensely. And then, some it's more just kind of check-ins because typically, when we're working with people, it just ranges. So some people need more, especially when we first get somebody, at that time they're going to need more support. And if we're doing our jobs right, as time goes on, right, they're going to need us less and less because we're connecting them to, those natural supports.
Sure. Okay. So there were three main things I guess I wanted to talk to you about, and that is like human trafficking victims, the people who are kind of in the life right now, whether it be sex or labor trafficking, human trafficking survivors, which you've been talking a little bit about, the people who, Bakhita Empowerment Initiative is serving, or other organizations that work with survivors might be serving, and then like the services themselves. So we talked a little bit about that, but I kind of want to back up. I mean, do we have any information about how victims who are currently being trafficked have been affected by quarantine, have been affected by the disease, or is it still too early to know any of that information?
As far as I'm aware, and I've been kind of in communication, whether it be webinars or emails with like, people on the local and national level. And I think it's just too early to be able to tell really how they're being impacted. But if I were to, garner a guess, I would say that right now, traffickers are probably taking advantage of the situation a little bit, right? Because those that could typically identify if a person's being trafficked, like law enforcement or healthcare, I mean, they're overrun, right?
Sure.
Like, like, and so they don't have, maybe the necessary resources on hand to be able to identify. Another thing that I am, concerned about is, those that are being trafficked, their exposure to COVID, because, more than likely they're still being made to work in some way, shape, or form, and, may not have the necessary, personal equipment that can keep them safe. So not only are, they, at risk of catching COVID, but then turn it around. And if they've caught COVID, then there's that risk of giving it to other people. And also, it's during this time, it's just like, with domestic violence and the concern about, people's violent behaviors increasing during this time. There's concern about that there may be more violence directed towards those that are being trafficked, just because it's a high stress time across the board for everybody.
Sure. And I know in Kentucky, especially in the rural areas, there is a correlation between drug use and trafficking. And I haven't heard anything about how, people who, for example, might have an opioid addiction are able to kind of get their fix right now with things being shut down. I mean, are people still accessing drugs? And if they can't, how is that affecting their ability to function, and like, does violence increase at that time? Things like that.
I mean, you can only imagine that it does, just because, again, that high stress, if you're not able to access, what it is you need, whether that be drugs or something else, then, tempers are going to rise, like our trauma response will rise. So there's just a myriad of factors that can go into that.
Sure. Is a lot more about what's happening, I guess, regionally and nationally with organizations that do the trafficking service work once people have been identified, and then also who kind of are working with like law enforcement. Is there any groups that are working on specifically either doing work to identify human trafficking victims at this point, or is that just all been shut down?
Every organization that I'm aware of is doing work on some level. It may look scaled back, but oh, that's awesome. Thank you. Sorry. It may be scaled back, but it's just like we have continued to receive referrals from other agencies and places. And so we are just doing the best that we can with that. We've done some virtual screenings just to kind of get, a sense. Because when we are working with someone, the first thing we have to do for our organization is identify, if there has been trafficking has taken place through those, the federal definition. And if we're identifying that, then we're working, with that person and other agencies to be able to meet that person's need the best that we can.
Okay, sure. And
so everybody's still working. It's just gonna look, it just looks a little different these days.
Right. Yeah. And then I probably should have checked Polaris's website, but Polaris Project is like they run the National Human Trafficking Hotline, which if I'm able to save this for later, then I'll include that hotline number. But I haven't seen anything.
Do you want me to give it?
What's that?
Do you want me to give it?
Yeah.
Oh, were you gonna include it like on on the screen somehow?
I can actually pin it as a comment.
Okay.
Go ahead.
So it's 1-888-373-7888.
373-7888.
Yep, lots of eights.
Yeah, I remember that it's like a palindrome, but I never know what is in the middle of the 888s. And so this hotline obviously is not just for people who are being trafficked, but also for people to report if there is, if they see trafficking.
Yes, and that's a great place to report if you suspect trafficking, because the national hotline has a like kind of system set up with law enforcement here in Kentucky, so that it's, when there is a report made to the hotline, then they send it to the sheriff's office, and then the sheriff's office then sends it out to the appropriate law enforcement.
Okay. Yeah, and I'm on Polaris's website, and I don't see anything specific to quarantine or COVID-19 at this point. So it looks like a lot of this information is still kind of being developed, still coming in. So in terms of vulnerabilities that human trafficking victims might have, can you think of, well, let's talk a little bit about general vulnerabilities that they would have, and then we can talk about how quarantine might change those. So can you tell us a little bit, like, I guess let's talk about labor trafficking first, some of the vulnerabilities that labor trafficking victims might experience.
Um, what do you mean?
Sure. So like, like access to resources, ability, like usually when you think of labor trafficking victims, you think about people who are not being paid or being paid very little. And so like those types of vulnerabilities. And then on the sex trafficking side, access to healthcare, things like that.
Right. So, a majority of, whether it's labor or sex trafficking, there is that vulnerability of not having access to services. Labor trafficking, a lot of times we do see foreign born that are involved in labor trafficking, and they may have had their documents taken away. So even if they were able to somehow get out of the situation, they may have nothing to be able to prove who they are, or to use to get any resources whatsoever. They are less likely to be able to seek medical help. Overall, even when someone who's foreign born has maybe gotten out of the situation, we struggle with being able to connect them to resources because they might not have the appropriate documentation at that time. And we work with a lot of people on applying for their T visa, which is the trafficking visa. It's specific to survivors of trafficking. And one big vulnerability that we are seeing with that is that, just even 2 years ago, if you applied for a T visa, it was taking upwards of like 6 months to receive. It is now currently, I believe, don't quote me 100%, but I believe it is like 26 and a half months. So during that time, they are unable to, apply for a social security card or a license, which then means that they cannot work. And if they don't have that, then they also, it's harder to get access to housing. Mm-hmm. So, we are lucky in the fact that we, are a program that can provide financial assistance throughout that time. But that also does then drain our resources to be able to assist other people. And I am really concerned, especially during this time, if that's going to, put a hold on it even more. Like if that's going to, are they still processing applications, or has that is that not occurring? I don't know at this point. And so those are really big vulnerabilities, because if you're thinking about, even if you're getting supported, the stress of that, just waiting, knowing that some nameless, faceless person basically is looking at your application and has your fate, in their hands, that takes a huge mental strain. So even if we weren't seeing any mental health issues in the beginning of working with somebody, you got to think about if you're waiting 26 and a half months to just see if that T visa is granted so that you can work, and you can drive a car and all that. It really does take, a drain on your mental health. Sure. So we're seeing that quite a bit now. And then, with sex trafficking survivors, it's the same. It's like not being able to have access to those resources, not being able to get medical services when needed. Sometimes, that there may be a criminal charge on their background that's related to the trafficking, and that can make it harder for someone to get a job or harder to get housing. And housing is just a big vulnerability for people anyway, housing instability. Overall, I think, especially in Louisville, there's a huge housing crisis. The homeless population continues to rise. I can't do it right now, but I'll do it when I get done, okay? I will be done in just a little bit. I already told you. So, if you're on a housing, list, that could take up to 1 to 2 years to get. So what do you do during that time while you're waiting? And housing instability could then, cause another host of instabilities. So, there's, food insecurity. There's just so many ways that, drug use, we're seeing a lot of drug use in connection to trafficking. And, that can be exploited either by, the trafficker taking advantage of someone having a drug addiction, or the trafficker, utilizing that as a form of, force and coercion to have them, become addicted to drugs. So there are many different vulnerabilities, with both populations.
Right. So kind of talking more about the housing insecurity situation, and specific to Kentucky, there's still no dedicated shelters for human trafficking victims, correct?
There is,
Is it one now?
no, there's residential programs, like there's Women of the Well. It's not necessarily specific to trafficking survivors. It is trafficking survivors, women who have experienced domestic violence. And in Lexington, there is a place called the Refuge for Women that is a 2-year program. And they are actually creating, it was supposed to have opened, I think, in April this month, but I'm not sure if they'll be pushed back or not, where it is a very temporary shelter, because what we're identifying is, sometimes when there's a referral made, we don't have a place to house them, right away, because the domestic violence shelters may be full, other shelters may be full. We have the ability to provide emergency housing in the form of hotels, but we use that, when somebody's, safety is not in question, because, those shelters are going to be the safest option. But, as we continue to have a, issue with the housing crisis, that then brings, issues with shelters being, not able, like meeting their capacity, like, quickly. But so there are a few, but if, you notice what I said is it's, it's homes for women.
Right.
So, we don't have any, dedicated shelters for males. And then when you're talking about labor trafficking, outside of our program, we're the only program statewide that I'm aware of, that, serves labor trafficking survivors. And then we don't have a shelter.
Right.
So, we're able to provide like some more transitional, housing as we're waiting for like long-term, housing. But, so there are some, programs, but not enough to, meet the need, unfortunately. Like
Right.
none of us right now that are, operating the anti-trafficking, programs, have the capacity to meet the need that is going on.
Right. And can you tell us a little bit about why like a dedicated emergency shelter would be needed just for human trafficking survivors versus like just a shelter that, serves more than human trafficking victims, like domestic violence victims as well?
It would be helpful just in that, like for trauma purposes. Sometimes when they're, a person might be in more of a general like shelter, there's concerns over safety. There's been concerns of like, trafficking happening in shelters. So, having something that's dedicated, that has that trauma-informed response, that understands the trauma of trafficking. And what would be helpful is to have, a place immediately, because, when somebody is being referred and somebody needs to, leave an unsafe situation, their first concern is going to be safety and safety only, right? And getting out of that situation. It's not like, hey, I'm Amy, do you want some case management, right? Like, they need a place to kind of land for a minute and maybe just like even catch their breath. And then, figure out what next steps are. Is it most appropriate for them to be in a residential program? Is it more appropriate just to, to have case management? Is it most appropriate for them to leave the state and go somewhere else where it's safe? There's so many factors that you're probably not going to get, like to the heart of in that moment. And then, and have a person, be in a place where they have time to kind of feel more at ease. Because again, if I'm coming in and I'm Amy and I can offer all this, well, they don't know me from Adam, right? And there have been a lot of times that, systems, unfortunately, have failed people. So, it gives them that time to catch their breath and just kind of identify, and then also, can build up some of that trust a little bit.
Right. And then in terms of, I know at least a couple of years back, there was an issue with people who were either drug dependent or like, high when they were coming out of their situations. And I think most shelters will not take people if they have drugs in their system. So has that problem been resolved yet? Is there anybody that will take somebody who is on drugs who needs emergency shelter?
I have not heard of that changing in any way, shape, or form. We try to connect people to different types of programs that can assist with that if that is what the person wants. There's a program in Lexington called The Well, and they work with those that, have come out of addiction that are, also have been trafficked, kind of working with that. But, ultimately it's going to be, that person's choice. And so sometimes it's maybe you're looking at other things that you're assisting with first before you're, looking at that addiction issue.
Sure. Okay. And we've kind of been talking mostly about like adult trafficking victims, but obviously child trafficking is also a problem both for labor and sex trafficking. And generally speaking, the cabinet handles those cases.
Yes.
Right. I mean, you all, I don't think have any minor victims or minor survivors that you all have generally worked with.
No, we do. So we do.
Okay.
And, it's not a large percentage, but we have, in the past either, especially with labor trafficking, because there's, again, not as many services for labor trafficking, whether adults or, minors. And sometimes we just kind of worked in conjunction with the cabinet to provide like that extra layer of support. But the cabinet's going to be the first line of defense, basically. They're the ones that get the report, and they're the ones that investigate and, identify what needs to be put in place.
Sure. Do you know if any of their, protocols have changed since like mandatory social distancing has come into effect?
I do not know that.
Yeah, me neither. I probably should find out because, I mean, typically speaking, they're supposed to respond within an hour to any report of child abuse, child sex abuse, or child trafficking.
Well, that changed a little bit. So as far as I'm aware, they changed the response time. I think it's within, and don't quote me, 3 hours, just because, in the more rural areas, you might have one worker who's covering like 3 counties.
Right.
So you can't, realistically get maybe from 1 county to 2 counties over within an hour.
Right.
But they do have a specific amount of time that they have to respond to it.
Right. And that typically involves an actual physical going to, wherever the child is. I mean,
yes.
I think usually they're with law enforcement at that point because they're more likely to have gotten law enforcement involved before child protective services.
Right. I would assume that, they are still performing their functions, but, have put some types of policies in place. I know that like one of the child advocacy centers that does, their forensic interviews, they've been working from home, but they've put some things in place that they're still able to do their jobs. Right. So I am sure that the cabinet has, put something in place.
Right.
Don't know what that looks like.
Sure. Yeah. And I can only imagine, if you've got a family, the kids are at home, it's a high stress situation, and there's no income, that it's really just unfortunately a perfect storm for potential for trafficking.
Yeah. I mean, it is for, for children, it is for adults, because there's going to be that increased anxiety over, how do we get, even our basic needs met? How do we pay the rent? Because I mean, it looks as if like some landlords are being flexible, but not all. And I know that, we have that great line now for like the unemployment, but what I'm seeing is like some people have been on hold for like 3 days. So I'm sure that line is getting, inundated with calls. So that's just going to increase the anxiety and that we need, something needs to be done to get that
Right.
need met.
Right. Well, the Supreme Court has denied any eviction filings for the next 30 days.
Well, that's
They decided that yesterday, and it's 30 days from yesterday or from today. But
good.
yeah, so no one can file any evictions. And obviously, there's no set outs occurring based on past evictions currently as well. But
And the courts aren't working right now, aren't
so the courts are
occurring.
kind of open, like for like criminal cases and domestic violence issues and things like that, but like a weird sort of, like if you have a case that involves like an emergency situation,
Right.
then the attorney and the party can go in to the courthouse. But like, for example, I usually don't handle any emergency matters, so I can't go to the courthouse even if I wanted to.
Right. Yeah, I know it's
Yeah.
scaled down, and so I assume that evictions would probably be not on the top of anybody's list.
Yeah, so the governor issued a no set out order for any evictions that have been have already happened, like have already gone through the court system. And then the Supreme Court said you can't file any evictions for the next 30 days. So of course, a lot of organizations and people are saying to tenants, don't pay your rent at all because you're not going to get evicted, which is probably, I mean, personally, I think that's sound advice because the more people who don't pay their rent or their mortgages, I mean, honestly, that's like going to require the federal government to come in and have some sort of like, I guess, option to forgive those payments or to, pay mortgage companies and landlords that money instead of tenants.
Right.
But there's also the very real possibility that if enough people pay, that the few people who didn't pay in like a month or so are going to end up getting evicted because they've had like a month or two without having paid rent and they can't catch that up.
Right. That's a very big concern.
Yeah. And, like you mentioned with the vulnerabilities in general, if housing insecurity was already a vulnerability, it's not going to get any better now.
Well, and so, something that we are actually seeing too is not only, like the anxiety over current program participants, we've been getting, phone calls from past program participants. Like kind of just reaching out, and it can be, it's kind of ranged from just like needing that emotional support, to needing financial support.
Sure. And I mean, how does your program then deal with those requests? I mean, are those filtered out to other agencies, or can you at this point handle them?
So, what we are kind of saying is that we, anybody that's being affected by this COVID, we do not want to leave them like, in the lurch. Like, the whole point of our program is to support, during vulnerable times. I mean, we're also, we also have to leverage resources where we can, because we do have to look at, the stark reality of, we have limited funding, and we have to make that last for as much as we can. So it's like, it's a balancing act right now. We're not going to leave everybody in the lurch, but also understanding that, we don't also want to completely drain funds, because then, when this is hopefully is all over eventually, people are going to need, I feel like sometimes people might need more as they're trying to get back on their feet.
Right.
But that's, that's the, the point of having, one of the points of having strong collaborations. And, again, if we're doing our job right, we are leveraging our resources, identifying what's in the community, and figuring out how we can work together.
Sure.
So it may look at sometimes, if one program participant needs something specific, that like we can provide, but there's another agency that, that's what they do, then maybe we're leveraging that resource so that, we can provide for, other services that maybe might not be out there. So again, like, thinking about like, those that we're working with that are foreign born that right now are waiting for their TV set and really don't have access to much at all.
Right. Because like, for example, that stimulus check everyone's waiting on is not available to even tax paying undocumented people.
Right.
So, if you're here waiting for a visa, it's pretty unlikely. Well, I think it is not likely that you're going to get it at all.
As far as I'm aware, that's not happening, and so we have that in the back of our minds that, there's a, large percentage of our program participants that are, going to need, that financial assistance for quite a while.
Right. And that was going to be one of my questions. It's just, if this quarantine extends to like more than, I guess May 1st is right now, is like the general idea is how long it's going to last, but it's very likely it's going to go into June or July. So what kind of challenges do you see based on a longer term quarantine?
I mean, I think, the challenge of like how to do our jobs effectively. For right now in the interim, it's workable,
Sure.
doing this kind of remotely. But, having been a case manager, for a really long time myself, I've just kind of transitioned out of doing direct services at all in the last couple of months. I know that case managers, this is odd for them. Like they're, we're used to being, in person, providing that support where we can. And so, I think for service providers, that will be a strain on feeling like you're not doing all that you can do, and I mean, we are doing all that we can do given the current reality, but it is very different than what we usually do. And, if it goes forward that long, I think we would just become even more creative on how to make sure we're meeting needs for our program participants, because at the end of the day, that's what we all pledge to do. That's what's most important to us, is those program participants. So, we will figure out how to be creative, with our services, with our budget, whatever it is that we can do. And that's just not, with Bakhita, that's Catholic Charities at large. Because, we have so many different programs that serve so many different communities. And, like from the get-go, that has been the commitment, is that we are not going to not serve people, that, we have been serving, or, in the future, because that's what we're all about.
Sure. Well, is there any, I guess, good to come out of like doing more remote work? I mean, is there any efficiencies, or is there anything like hopeful coming out of this?
Like I feel like, like personally for me, like sometimes working from home is nice. Having to school my children, and that is not my forte whatsoever.
Sorry, you cut out. What did you say after you said you were like working from home is nice?
It's nice, but it's like it's been a balancing act, trying to do my work and also school my children, and I don't know anything about schooling my children.
Yeah.
So that's been a drain. But I mean, what I have found to be really, really positive about this, just speaking as a program, is, we're a program of 5 people, and we, serve the whole state. And I feel like we have all just really come together. We were supportive of one another anyway, but this has really like caused us to just be like super supportive, to where we have developed, we do every day at 3:30 a staff check-in call. And that could be 10 minutes because everybody's doing great, right? Or it could be an hour because everybody's just having an overwhelming day. So I've just seen that the staff as a whole has just grown stronger, which I think, once we come out of this will only help to strengthen our program as a whole.
Okay.
So I think that's the positive I see.
Yeah, well, that's great, because I think having those check-ins and communicating with the people who kind of understand what you're doing and what you're going through can be really helpful.
Yeah,
So I have to ask, and this was not part of my initial like question set that I sent to you, but have you watched Tiger King?
oh my gosh. Yes, we watched it in a weekend, like
Yeah,
over this
same.
past weekend.
Okay, so somebody had asked me, is the relationship that Joe Exotic, the Tiger King, have with his husbands kind of trafficking? And I was like, well, I don't have all of the information, but there did seem to be a sort of like exchange for, I guess meth,
Right.
um, for a relationship, maybe not just sex, but like a long-term marriage. So do you have any thoughts on that?
I mean, I don't have enough factors to go by to say, whether it was definitively trafficking or not. But I mean, he was definitely exploiting, um, you know, both of those men's like, or I guess three, right? Because over the course of the show, he had three husbands. Because there is a current husband that had been interviewed, right, towards the
Yeah,
end.
the one without the shirt, right?
No, no. So that was like his husband with the other guy who passed,
Yeah, yeah, okay.
and
Yeah.
then another
So
dude. So sorry if we're spoiling it for anybody. Um, um, but there, I mean, he was definitely exploiting vulnerabilities. So he was exploiting, at least the one husband's drug addiction,
right.
for that. So, I mean, you could probably make a case, but there would have to be so much more information to be able to, identify.
Yeah. Yeah, exactly. And then Travis, the middle husband, we won't say what happened to him, but like there was, I guess people were saying that he wasn't allowed to leave the zoo, and like his access was restricted to like people and going out and doing things. So that definitely goes
It
in more
has some
towards like
elements.
trafficking.
Hmm.
Yeah.
Definitely has
So,
elements. So you definitely could make a case for coercion.
right.
Hmm.
Yeah.
Which
Um,
is, when we talk about trafficking, coercion is the one, that traffickers utilize quite a bit, but it's really hard for people to wrap their mind around like what that really is.
sure.
'Cause again, like as I was talking in the beginning, you know, um, people understand it in the force. Well, they were restrained or they were beaten, and really have a harder time wrapping their mind around like the fraud, like the Romeo trafficker, or that coercion piece. Because it's hard. You can't take fear out of your body, right, and put it in front of somebody
Right.
and go, no, no, that's for real. Um,
Right.
so yeah, Joe Exotic was definitely coercing in a myriad of ways.
Yeah, exactly. All or most of his husbands.
Yes.
Yeah. And
Yes.
then like same with Doc Antle or whatever his name was, because he's got like the harem situation going on with all the
Oh yeah.
girlfriends slash wives, which is also weird because they all seem to be like transfixed with tigers. Like there are levels and like there's layers to that whole situation that like there's definitely exploitation going on, but it kind of like is true to why trafficking is so difficult to show in coercive situations, because it's really easy to look at those women and be like, they're just tigers, get out of there, you're being exploited, get out of there, right?
Right.
But we don't know the whole story or how these women truly feel.
Well, and with him, it was, I mean, it's definitely like very cult like.
Yeah.
And, so it's kind of interesting you bring that up because, like, our program has identified that there's a need for like further education and kind of talking more about that fraud and coercion piece.
Mm-hmm.
Because there's been a lot of, which is fantastic, a lot of, HT 101, who's kind of brought all of that to light. But what we had kind of noticed then is we had been getting referrals from like different people, like professionals and community members, and were insistent that something was trafficking. And we would do a screening and be like, there's no element, and they're like, well, they took them across state lines. And I'm like, but that, just because they took them across state lines doesn't mean trafficking. And so we've identified that there is a need for like more training on the nuances of what trafficking is.
Right.
And, really kind of coming to terms with that, we have these like, red flags that we talk about, which there are, but, there could be a person's being trafficked that has none of the, stereotypical like red flags, and that it's going to be incredibly hard for, a large amount of people to be able to really even identify, especially in terms of labor trafficking, because, when are you like at a restaurant all day long to identify that somebody didn't get a break, or when are you just like up, on the farms? So it's like, maybe we need to be educating, on specifics to specific populations, right? So if I were educating you, it'd be more specifically to what you were seeing, what you could possibly see in like, the legal field.
Right. Yeah. Well, going back to Tiger King, I mean, a lot of the people that were working on at Joe Exotic Zoo, they said that like they were being paid very little.
Yep.
They're living in squalor. Presumably they could have left that job, but like there were so many weird, like psychologically exploitative things going on. Because even Joe Exotic said a lot of the people were like, had like recently come out of prison. They didn't have a lot of other options.
Yep.
And I think that is really the most difficult piece of human trafficking that is hard for people to understand, because like exploitation is so individualized, and it's so manipulative that like, I could say, well, I wouldn't be eating like, Walmart, like expired meat. I would just leave. But people who I think are in those situations don't look at that calculation the same way that I would, sitting here safely in my basement with food upstairs, right?
Right. Yeah. Because you have, like for that, you have an option.
Yeah.
Right. So there's options. And also you have to take into the factor of like, how you were raised and all of that to like, and really, and it's so individual, for each person's being trafficked, because you're really then not having to look at, the motivations behind each person, because what would motivate me, right, or make me vulnerable is going to be different, possibly than what motivates or makes you vulnerable. And you have to look at those factors too. So in one situation, say, we had identical situations, but, like for me, it might be trafficking because of my vulnerabilities or whatever. For you, it may be, at the end of the day, your choice.
Right.
And we really have to look at that. And that can be hard, because I think that, at the end of the day, that's what's happening is, too, is people are kind of putting their own mindset on it. Like, well, clearly that's trafficking because I wouldn't have stayed in that situation. That would not have been my choice.
Right.
Like, well, no, it might not have been. But, you have to look at the individual, because for this individual, it may have been.
Right.
So, that's really, at the end of the day, what we have to get to the crux at. And that's hard. Yeah. That's very, very difficult to do.
Yeah. Okay. Well, we have only about 10 minutes left, and I know you have a webinar after this, so we can kind of wrap up, and maybe you can tell us a little bit about what people can do to help, and so we can at least hopefully end on a little bit more of a positive note.
Yeah. So, like I said before, all the Catholic charities, we are still operating. We are, doing all that we can on behalf of all of those that we serve. And, resources can be very limited. So any way that you anybody could, help would be awesome, in ways of like donations. We need Kroger cards. I will tell you that is a thing. When Soha ever asks me what it is that I need for the program, I'm always like, Kroger cards. We need Kroger cards. Just making a donation to, the agency to just help us continue to run. Toiletries, like any types of like non-perishable food items. Like anything that would help to serve our program participants. Okay. Can't say it enough, though. Kroger cards.
So Kroger
Or
cards.
Walmart cards, food
Right.
cards in any way, shape, or form. You know what else is actually very helpful for us is, and I don't think a lot of people think about it, but it's quarters. We need quarters because, you know, we have people that don't necessarily have washers and dryers. And so, you know, they have to go to the laundromat. And that is, you know, I think besides food cards is one of our big asks is quarters. Okay. And we are currently out, unfortunately.
Okay. How would someone donate quarters right now, though?
Oh, that's such a good. If anybody wanted to, like, you know, our building is closed to the public, but, you know, I'm probably there like once a week just because I need to get stuff. And so I'm happy to meet anybody, you know, outside of the office, you know, and pick them up. Okay. You can just throw them at me if you want to, like, you know,
quarters are
my
heavy.
general direction. You can just drop it. I will stand by the door. You can just drop it and then, you know, drive off and then I'll come, you know.
Right. Like a sketchy exchange of quarters is what you're proposing.
But yeah, any we will be creative, you know, because I also understand the concern. So, I mean, at the end of the day, probably just what would be easiest is just people mailing in monetary donations to the agency. And it can either be to the agency as a whole because, you know, we have the migrant refugee services, we have family support services, we have Sister Visitor who serves all of the 40212, you know, zip code for clothing and food and utility assistance. We have the language access, we have the ESL, we have a ton. So it could either be made out to Bakhita, or it could be to just, you know, like the agency as a whole, Catholic Charities.
Yeah. What's the website?
cclou.org.
Okay, great. And they can donate obviously on the website as well.
Yes.
Okay. All right. Is there anything else you want to add? Information or requests for assistance, anything like that?
I just, you know, want to ask that everybody out there that's watching, you know, just send, you know, survivors of trafficking, those that are currently still in trafficking, and all the service providers, like positive, you know, vibes. There's a lot of people doing great work, and, you know, we're all feeling the strain of doing it in a different way, and feeling the strain of not necessarily being able to meet everybody's needs just because of the overload on resources right now. So, you know, besides like donations, we could really, really use your positive vibes. Okay. Well, I mean, hopefully people can, do at least that, right? But thank you very much for everything that you do and that everyone else at Bakhita does. We appreciate it very much. And I will talk to you soon, but, yeah, if anyone has any questions, send them to me and I will get them to you as well. Awesome. Well, thanks for this opportunity, and thank you for all that you do, Soha. No, it's no problem. I really don't do much. So it's yes, you do. Yes, you do. It's appreciated. Well, thank you. Okay. Bye. Have a good day. Bye. See you later.